So I just want to say good evening, everyone, and thank you for joining us. We do want to show our founders there on the SLSS, and so we're very excited that they took the opportunity to start this. Next. So Latino Surgical Society was established to cultivate, nurture, and support the advancement of Latino surgeons, and today's event is in line with that mission. And we want to thank our institutional members on our next slide who have supported LSS, but also the faculty and trainees at their institutions. And lastly, we want to thank all of you, our members, friends, and allies, for supporting and believing in the Latino Surgical Society. If you have not done so, I'd like to encourage you to visit our website and become an official member today. And so tonight, we welcome you to the second installment of our new series, where we highlight the experiences of residents who matched in competitive fellowship programs. We hope that their experience in this event will offer you some wisdom and guidance that you can take into your own careers. Today's installment, we will talk with 4 future surgical oncologists. And to begin, I have the pleasure of introducing our moderator tonight, Dr. Rick Valalidas. I totally butchered that name, sorry.
Thank you, Dr. Reina, for the introduction. I'm very excited to be here and also excited to introduce our wonderful panelists today. First is Dr. Diego Hanssen. Dr. Hanssen received his medical degree from La Universidad Central de Venezuela and subsequently completed his general surgery residency at BronxCare Health System. He is a current Breast Surgical Oncology Fellow at Moffitt Cancer Center in Tampa, Florida. Welcome, Dr. Hanssen. Our second panelist is Dr. Helen Johnson. Dr. Johnson received her medical degree from Warren Alpert Medical School at Brown University. She later completed her general surgery residency at ECU in Greenville, North Carolina, and then a Breast Surgical Oncology Fellowship at MD Anderson in Houston, Texas, where she is currently an assistant professor in the Department of Breast Surgical Oncology. Our third panelist is Dr. Odette Caster-Solis. She received her medical degree from the University of Virginia School of Medicine in 2018 and completed her general surgery residency at Inova Fairfax Hospital. She is currently a Breast Surgical Oncology Fellow at Vanderbilt University. Welcome all, and thanks so much for joining us tonight. So to dive right in and begin, can each of you share why you chose to go into breast surgical oncology?
I guess I'll start with my story a little bit. So my dad's also a general surgeon, but he's a minimal invasive surgeon. So I guess he was kind of like expecting me to follow his steps. But when I was doing general surgery, I got entangled a little bit more with breast surgery, and at the same time, my grandmother got DCIS in my route to becoming a general surgeon, and that sort of like propelled me to be more involved. I also did residency in a very poor community in the Bronx, and I feel like the relationship that we created with oncologic patients in such poor demographics changed the way I view cancer. And the oncologic patient is very different in the surgery world compared to the general surgery population. When you fix a hernia, you never see them again. And, you know, when you're treating cancer, you sort of like develop this lifelong relationship that sort of like brought me to breast.
I think some of my reasons are similar. I really love that longitudinal relationship with patients. I love taking care of a high proportion of women and kind of the impact on women's health. And I have a niche in the intersection of breast cancer and breastfeeding, so that is relevant as well. But I really think it's a really beautiful field with a great blend of the science and art of medicine. You get into a lot of details, especially at tumor board, you know, talking about pathological details, imaging details, the biology of the disease, but it's a very individualized approach to treatment where we consider the whole patient, and that's where some of the art of medicine comes into play.
And then for me, just to sort of tag along, I went into general surgery thinking I was going to be a trauma surgeon. And breast surgery obviously is very, very different from that. But one of the things that drew me to trauma surgery was that I wanted to feel like I was there for a patient on the worst day of their life. And I loved the teamwork aspect of trauma. Obviously, I left the operating room. I went into general surgery. But what was missing once I actually did trauma and did those rotations as a resident was sort of that long-term follow-up. I felt like I saw that patient in that point in time, and then they don't remember me. I don't remember them. It was just this one-off thing. You don't really have this long-term follow-up or relationship with the patient that I felt like I wanted long-term in my career. And so, not to make comparisons or overlap between trauma and breast surgery, but breast surgery had that. And in some ways, you are there for that patient on the worst day of their life. And you see these patients come into clinic with just the look of just absolutely terrified and like horrified about their diagnosis, and you can get them through it and get them to a place where they can live their life, live a long life and not think about their breast cancer again is a pretty awesome thing. And so that all happened for me kind of around my second year of general surgery training. And then around all that same time, I just happened to have some really wonderful mentors in the breast surgery world. And I think working with them and starting to do some research with them, which we'll talk about, really made the field that much more appealing to me. And I think a lot of people in this room will probably agree, if you're working with surgeons who really, really love what they do, it makes what they do really attractive. So you could work with, in a field that you don't really aren't interested in, but if you're with a surgeon who really loves it, it makes it kind of fun and more enjoyable. And at the same time, you could be doing the most awesome surgery in the world, but with someone who's miserable, it's pretty terrible. So that those things all kind of happened for me at once. And so it sort of made it an easy decision.
Yeah, it's very interesting, definitely inspiring as well. And I think it's really true. It's really rewarding to be able to not only have a longitudinal relationship with your patient, but really to be able to care for them in their most vulnerable time of their life. So thank you for sharing that. Did any of you initially consider applying into complex surgical oncology and then tailoring your clinical practice into only breast surgery?
I didn't think
No.
of applying for fellowship. I mean, early in my residency years, I was debating between general surgeon with heavy focus on breast and breast only, and made that decision, kind of by my second or third year.
No, I didn't want to do any Whipples. So.
Fair enough. I totally agree with you. So since we're here sowing for success for future breast surgical oncologists, did you all do research before applying for fellowship? And if so, in what areas?
I did research. I think it's very important if you're gonna apply for any sort of surgical oncology field. I did more populational research. I was in a very small community program, so most of it was clinical, but I was more interested in like the populational and demographic changes in surgical oncological patients. But it's definitely something that you need to have in your resume to have a better or well-rounded application for a surgical oncology position.
I also did a lot of research, but I love research, and I actually did a 2-year research fellowship in the middle of my residency, and that's part of my job as an attending now. I agree for the most part, but I kind of give the caveat when I'm giving advice that it doesn't have to be research. Like if your passion is not research, I don't think it's worth doing research just to check a box. I think it's more important to do something that you're really passionate about, whether that is a quality improvement initiative or a patient experience initiative, advocacy work. So some sort of extra clinical work and whatever you're most passionate about that you really go the extra mile on, I think is much more impressive than just, I presented an abstract for something because I needed to.
Yeah, I totally agree with that. And I think the research piece is a lot less about having the publication out and more so about having interests in the field of breast surgery. So whether that's related to a research project or not. I had done some stuff related to like DCIS. We did some projects with MagTrace. We looked at some IgM registry data when I was a resident. So I had some experience with that, but yeah.
Yeah, thanks for sharing that. I think that especially how you mentioned Dr. Johnson about finding a passion and moving forward with that is also really important. So continuing on, during the interview process itself, how did you differentiate fellowship programs? And what advice would you give the audience with what to look for when choosing a fellowship program? Maybe this time we can go in reverse order to switch it up a little bit.
Sure. So I think all three of us were virtual, right? and Diego, you're my year, and then I think you were a couple of years above me, Helen. Okay. So it's all virtual, so it's really hard. And I think one of the biggest differences in applying to residency versus fellowship is that residency is a lot longer. You're spending a lot more time in the city that you're going into. So the things that you're looking for are a little bit different. But in terms of differentiating them, I think one of the bigger things to me was being able to talk to the current fellow that year, and getting a feel for that, because otherwise most of these interviews will feel like a PowerPoint presentation that the program director puts together, which is lovely. And then you have these one-on-one or group interviews depending on kind of how it's organized, and they're all pretty similar at the end of the day. But I think being able to talk to the current fellow is really helpful, and then kind of seeing where fellows have gone afterwards out of that program. So if you're trying to be in a very specific, academic or rural or anything in particular that you're looking for, just make sure that they are graduating fellows that are able to do those things.
Yes, my interviews are virtual as well, and I also found talking to the current fellows to be one of the most helpful things. I considered multiple factors, so I didn't have a ton of guidance because no one had asked for my residency for like 10 years. So I did reach out to that person who I'd met, in passing, but things were different. The number of programs to apply to, all of that stuff was all different. So I just got connected to someone who knew someone and got advice from as many people as possible. And then that way I was able to narrow down my list and not have to apply to as many places as well. So I took location into account. I know it's just 1 year. Some people choose to live apart from spouses and such, but I have 2 young kids and I didn't want to do that. So I took location into account and my husband's job and things like that. And then I think definitely job prospects. So I knew I wanted to be an academic surgeon with a significant research component to my career. So I favored more academic programs to prepare me for that career and what sort of research or additional training options there were. For example, MD Anderson has a dedicated clinical trials course for its fellows that was of particular interest to me. And then, some advice I give in general is similar, where you're going to you want to be a community breast surgeon. Think about that in terms of your training, because if you're exclusive center, you're not going to see very much benign disease in fellowship. And that may be fine, especially if you've had a really strong background in residency, but to think about that. I definitely talked to the current fellows about their job application process, how, by the time we were doing our interviews, it was a time where everyone pretty much should have had a job lined up or almost lined up at that point. I think those are the main things that I looked at. Oh, I also really wanted co-fellows. So that was a personal decision. Most programs are one solo fellow, but there are, several that are 2 or more. And I really wanted to have co-fellows, and that was one of the best experiences of my life. So I'm really sure I did that.
Yeah, I have to agree with most of what you said. I think talking to the previous or current fellow, it's crucial. They are the ones that are going to give you the real overview of how that program rolls. Most of the time, the programs are just trying to sell themselves and get a good fellow. So the good information is going to come from them or from previous fellows. I did take into account location. That was on the top of my list. I spent 5 years in New York shoveling snow. I was definitely not trying to do that anymore. So Tampa now, it's definitely a change. I did want to have co-fellows. I wanted to split the burden of making the call schedule, seeing the patients. I think life gets significantly easier when you have somebody that's going to split the burden of the work. So that's something that I took into account. And then, yeah, definitely you have to realize that there's 2 kind of problems. It's either more community lined up or more academic, and it's sort of where you see yourself going after fellowship. Sort of should be involved in that decision. Because it's true, if you come to just a cancer center, you're gonna see mostly malignant disease, and you're gonna sacrifice a little bit of the benign. Not that you cannot go out there in the community and practice that afterwards, but it's gonna be a little bit of a learning curve again after you get out. So those things I think that were essential choosing.
Yeah.
Oh, I have one more thing to add. an increasingly attractive opportunity is getting ultrasound certification through the ASBRS, and there is now an option to start that process as a fellow. And I would say that some more academic programs, especially ones with like, breast imaging fellows of some kind, it may be more challenging to get that certification as a, breast surgery fellow. And so if you are really hoping to have a job where you're doing your own biopsies, you're doing your own localizations under ultrasound or stereotactic guidance, that should factor into where you're looking to train.
Definitely agree. Yeah, thank you for that insight. I think that's very helpful to a lot of those in the audience. We just wanted to make a quick announcement that we appreciate everyone who's been adding questions to the question bank, and that we will take these questions and make them live at the end of some of the pre-written questions. What are also some tips? There's some tips that you can also share with the audience regarding the application process itself and the interview process, especially now since it is virtual. And most of us, when we apply to residency, all did in-person interviews.
Sure. So a few things. Try to take notes after every interview. The interview days, I don't know if they've changed this, but when we were interviewing, it was a mix. So you'd have some days that were like half-day interviews in the morning or afternoon. I had several interviews that were all day long. Like you'd start at 7 a.m. and my last interview was at 6 p.m. No joke. So some of them are very long. And so after that, you're just like really wiped out and you don't want to do anything, but try to take some notes on each or some highlights because you will forget. In the virtual world, I will say now people in general are probably interviewing at many more places because you don't have to travel for them as a resident, which is one, very expensive, and two, very hard to do to take time off. So now that these are virtual, it's much easier to kind of squeeze it into a clinical day or a round in the morning, go do your interview, go back and finish cases. So I was able to do a lot more interviews, I think, because they were virtual, but now the expectation is that everyone is going to do more interviews. So it's a lot more. So try to stay organized. I just had like an Excel spreadsheet that I just jotted down some important notes. For each program, there were some things that I just wanted to take note of in general. So like if there were co-fellows, what kind of ultrasound experience did they have? What kind of localization devices do you get experience with? Do they do their own biopsies? Sort of like just a few major specific things that I wanted to know for myself, and that list may be different for you, but I just took notes on those things and just kept a running list because it will surprise you at the end of this entire interview process. You look back and you're like, I don't even remember who I talked to or what we talked about at the interview or what that program is like. And you may have really, really liked it or not. So just take notes. And then in terms of finding time, I thought that the virtual platform was a unique challenge because in some ways, yes, it's nice you can do more interviews, but the harder part is that you're not given dedicated time to leave. So there were certainly interviews where I had rounded that morning on vascular surgery, sprinted to my interview, threw my jacket on, did my interview, and I'm getting phone calls in between interviews. I'm getting texts, the OR's calling me about something, a trauma's going on. There's a lot going on and you're still kind of on, if that makes sense. So try I don't know if anybody else in your class is going to go into breast surgery, but a lot of people are going to be applying for fellowship. So try to help each other out because those timelines don't always overlap. So if you can have your co-residents cover for you or help you when you're doing your breast surgery interviews and then just return that favor very nicely for them for whatever they need to do, it makes your life a lot easier and less stressful. So those are two of the big things. I don't think the virtual platform is going anywhere anytime soon because I think it just is nice for programs and then it's nice for applicants to be able to do more.
I would recommend finding a private space, which can be difficult to find in the hospital. Usually you have a shared call room or something, and no matter how much you try to coordinate with your classmates to be like, hey, can I use the call room from this time to this time? Inevitably something happens. So if there's a faculty member who doesn't use their office very often, or there's a spare office or anywhere like that, less commonly used call room, I would try to use that and kind of set up camp there. There's a lot of guides to kind of optimize your Zoom environment and make it look pretty and have artistically placed plants in the background and stuff. And that's all lovely. You can do that, great. If you can get those like ring lights or whatever, great. But I think the more important thing is to have a secure internet connection, which apparently I don't, since I just came out. I'm so sorry. And a microphone that works well and a backup plan, which I do have. Doesn't work again. But I wouldn't worry too much about all that other stuff. It wasn't something that was easy to afford or set up or really feasible. And I wasn't about to go buy plants and then have to water them, you know, periodically to in between my interviews to have them not die. So don't worry too much about that, in my opinion.
Yeah, so I think, as Odette said, you know, being organized is key. Some people will have a ton of interviews and you start mixing up places and you don't remember what's what at the end of everything, and you get even like, you know, interview fatigue. Like you can have even piece 2+2. That's one thing. And the other thing, start building your application early. Identify who are you going to ask for your letters of recommendation. People take time writing those, because building a well-rounded application takes time. And I cannot stress enough how many people I saw like running at the deadline trying to figure out that application, and then at the end they didn't get a lot of interviews because they didn't have like a proper application setup. So start early. If you're in your 4th year, you're already slightly late. Try to start even as a 3rd year. Identify who's going to write everything, write your personal statement, all these things with time, because it takes time.
I would also say to just bite the bullet and write your thank you notes, like either that day, next day. Don't put them off. It's better for them to be timely and like B+ work than to be A+ work and a week late.
Oh, and one last thing that reminded me is when you take your notes, take notes on who interviewed you, because you may not end up at that program, but we all go to ASBRS and you are going to see these people over and over and over again. And so try to remember the notable interviews, because these connections will come back later in your life in many other ways. And so if you remember who you had talked to and like, oh, I had a great conversation with that person, try to take note of that.
Or you may be interviewing for a job with them 1 year afterward. I also tried to write down how to pronounce people's names so that if I did have a follow-up phone call, which is uncommon but possible, I would not mispronounce it.
Yeah, I think those are really great tips. Were you all able to feel as if you got to know the personality of the program, so to say, through the virtual interface? How did you navigate that?
I'm going to say 90% of the time, I couldn't tell. It's virtually, it's extremely hard to gauge a program. I feel like 10 of the rest of the percent, I got more information from past fellows that gave me a little bit more like an overview of what's really happening. But from virtual interviews, it's really hard to gauge like what's going on. Sometimes you have to go by feel on how the interview went, because you're not really seeing the place, you're not seeing, you know, the facilities. It's hard. It's hard to.
And then similar to what you were talking about earlier, Dr. Hanssen, what are some additional, I guess, steps, and so to say, that you all did to prepare for a competitive application? And maybe you all can also discuss the importance of mentorship for the audience and how you all individually found supportive mentorship throughout your training.
I think mentorship, it's super important. I didn't have a specific breast mentor, but what I can say that it was really important for me for general surgery and for fellowship, it was building a network. This is something that worked for me, but I reached out to every single Venezuelan physician that I knew that was in the breast field, so they can give me information, number one, about programs, and if they were related to the fellowship. Sometimes I got interviews through that. And that's something that helps, you know, building a strong network by going to ASBRS early in your career. Trying to meet current or past fellows from other programs is something that opens doors. Not always, because you also need, you know, AppSite scores, research, and all these things to be considered. But this is something that really helps. And now, if you have a strong, dedicated mentor that is in the breast field, it's going to be a big plus.
Yeah, I was very fortunate to have a good mentor in residency that
taught me almost everything I know about breast, actually two, but one in particular had a connection to MD Anderson and was able to make like a personal recommendation. I think that was very helpful. And then I have another outside mentor that I did a lot of research with that also happened to have a connection to MD Anderson. And so I think those two factors, were very helpful in me getting to know the program better, and then, of course, hearing extra information about me.
Yeah, I also feel like I got really, really lucky in terms of the timing with the mentors that I had. So I said I had two big mentors in the breast surgery world. And then I think one of the really important things about finding your mentors is that there are different mentors in your life for different roles. So like I have sub mentors that I can call at 6 a.m. or 9 p.m. and they're more like friends. And I can say like I'm negotiating a job contract right now. So I'm like, what should I ask for this? Like, should I ask for more money? Is this reasonable? And I kind of can annoy them about those things. And then I have other mentors that I have more professional relationships with. And then I have mentors that are not even in the field of breast surgery. Like I have a really great mentor who's a thoracic surgeon, but he's in private practice, and I'm looking to go into private practice. And so he's been a great resource in terms of negotiating that contract and what that should look like, because even though he's not in breast, he knows that world very well. So they don't necessarily need to be breast surgeons, but having good mentors in the world of surgery in general, I think is very helpful.
Yeah, I think that's very insightful. Thank you. Thank you for those answers. With regards to mentors overall, this is a question that we received. Who did you decide to write your letters of recommendation among your different mentors, and how many in total did you submit?
I'm trying to remember. So I know I got one from department chair, because I was told to kind of do chair or program director. So my chair wrote a letter, and then my main breast surgery mentor wrote a letter, and then I had a research mentor letter, and then I also had one from the chief of surgical oncology.
Yeah, I think I also had 4. I think I had my program director, the chair, and then 2 breast attendings that were mentors and had worked with me in both research and clinical space. So I think I ended up with 4.
I did 4. I think there's 2 things that you have to identify for your letter recommendation. Usually you want to go like the higher as possible, like chair level, program director level, but also you got to identify who's going to write a more personalized letter, and not just some random, standard stuff in that letter, because that changes people's minds during interviews. So I went with my chair, went with my program director, and then 2 of my attendings that were not even in our hospital, but in our trauma rotation, that I knew that they were going to write something different in those lines. And I think that also changes how people view your application a little bit.
Yeah, definitely. I think that's very helpful. One of you all mentioned about potentially going into either, I know Dr. Johnson, you mentioned about going and staying in academics, since you are in academics, and Dr. Cancer Solis said that you were thinking about going into private practice. Taking that into consideration, how does that help you determine which fellowship may be best suited for you, which fellowship program?
So for me, I was looking for somewhere where I could continue to work on certain types of research and help decide if I wanted to kind of branch out into other types. So I really wanted to take the clinical trials course at MD Anderson as a fellow to decide if I wanted to kind of pivot and go from clinical research to clinical trial work. And I learned that I do not. So that was valuable for me. And then I knew that there was a big research infrastructure there, and I could collaborate. And then even if I wound up, working somewhere else, I could maintain those collaborations and then do, multi-institutional projects with colleagues that I developed relationships with during my fellowship. I also had a really strong training in benign disease as a resident, because I trained in a more rural area, technically an academic program, but more like an old community hospital that has an affiliated medical school. So I felt very comfortable with my benign training and was comfortable with going to a pure cancer center for fellowship, should I wind up working at an academic place that was not pure cancer and where I would have to practice the full spectrum of breast.
Yeah, and I would say I didn't go into fellowship knowing what I wanted to do afterwards, and I don't think most people do. But it was important for me to have some balance of academics, which I think you're going to get at the vast majority of breast fellowships because they're major cancer centers, that they're at major academic institutions. But then some of the things you might want to focus on if you're thinking, hey, maybe I might be in a community practice, I might be in a private practice afterwards, is just making sure that you have some exposure to benign disease. And then also, I think even more importantly, good hands-on ultrasound experience and some experience doing biopsies. So that's a question to ask in your interviews, is kind of what kind of biopsy experience do you get? Because some places will be, you just, you see some on your radiology rotation, or maybe you get to participate in some, and then there's a whole spectrum. So then there's some programs where you do lots of biopsies and all the surgeons do their own biopsies. And so that becomes commonplace. And then Vanderbilt's kind of like a mix between the two. And what they do at Vanderbilt is actually at the end of my year, since I'm probably going to go into private practice, but you do it at some point during your year. You get an entire month with a private practice surgeon who works here in Nashville and was a graduate of the program. And she does her own biopsy, she does her own in-office imaging, all that kind of stuff. So you get good experience with that and sort of the ins and outs of coding, billing, et cetera, if that's something that's going to be pertinent to your practice afterwards.
So echoing a little bit of what you guys have already said, but I did get a lot of benign breast disease training in general surgery because I trained in the Bronx, such a poor demographic area. So I wanted to go more like to a cancer center for dedicated malignant disease to see like the real interdisciplinary, treatment that these patients get here. So that brought me to Moffitt, and I also wanted to see the research side of surgical oncology fellowship, and how that works. And so that made me realize now in the fellowship I'm less of a research person, I'm more of a teaching or academic individual. So I want to go, I for sure, when I started fellowship, I wasn't 100% sure what I wanted to do after. Like Odette said, most of us start fellowship without really knowing, but once you're in fellowship, you start open and closing doors and see what you want to do and what you don't want to do at the end. So for me, it's I want to go something more hybrid, where I have the opportunity to teach and some research, but not like a huge academic center.
Yeah, thank you for that. I think that's really helpful. Another question that came in through the audience is if you could go back in time and give yourself one piece of advice as you were preparing for applications and for interviews, what would you say to yourself?
I think it's really easy in hindsight to be like, stress less and don't worry, because you use all those tools in the moment to actually motivate yourself to get everything done. But I think it's very overwhelming. If I think about my 5 years of residency and what was the most stressful time of those 5 years, I think it was the time that I was interviewing, because it's just all day, every day, and it's a constant feeling of feeling on. And so I think knowing that you're going to match, it's going to work out, you will match into a fellowship, it will be okay, is probably just good to keep in the back of your mind that it's going to work out.
For me, if I had to go back into something, I would say enroll earlier in SBRS, enroll earlier in SSO, build your network earlier. I didn't go to the first SBRS until last year, and I regret it a little bit because I made so much contact and so much network with everybody in there, that it's definitely going to be helpful in your interview process at the end.
Yeah, my thought was a little similar to that, which was to just try your very best to go to meetings sooner. I think that would have helped me. I mean, I was able to go earlier, but not just go to the meetings, but go with someone that can shepherd you around, introduce you to people, ask as a resident if you can do the fellows courses, which if there's room for, they'll let you do, or go to any of the events where you can meet current fellows. And I think I would have gotten a lot of helpful information from those people. And it can be hard. I mean, I'm a natural introvert, so peopling all day is very hard for me, especially with strangers. So I get it that it's difficult, but I wish that I had done that sooner.
Definitely. Another question that came in from the audience says there are many applicants that apply into breast surgical oncology, especially now with virtual interviews. How did you make a memorable impression?
I think for me, it worked just being genuine. Honestly, that's the best impression you can give these people. They'll sometimes will have like the most random questions depending on where you interview, and as long as you come along as normal, they're fine with it. Just don't try to overthink. You're gonna give the best impression you can give. It's honestly being yourself in those kind of situations.
Yeah, and I would add, whatever it is that's on your CV, know it well, because you'll just get asked it over and over again. And so, whatever it is that you're passionate about, all your hobbies they'll ask you about, whatever that is that makes you unique, be able to talk about it and explain that to them and be confident about it. And I think that comes across well.
Yeah, I definitely agree with just being genuine. I think those moments created the best organic conversations, and I still remember some of those conversations, and get to have kind of follow up with some of those people at meetings and things, or even on the job trail last year. And I think for me, and maybe it's not the case for all, but for me also, my impression wasn't so much just me, it was all of the back contact between, like, the phone calls between people that were recommending me and people that were interviewing me. So sometimes I would hear follow up, be like, hey, someone called me and they were like, is this girl for real? What's the real story? And they were like, no, she's as billed. And they're like, okay, that part of your impression is really important too.
Yeah, and I would add, going into these interviews, now that you've been a general surgery resident, you should recognize and understand that the people that are interviewing you also want to make sure that you're someone that they can operate with and stand across from an operating room table and work with and deal with. So things that seem obvious, like being a team player, being polite, being pleasant, those things go a long way, because they're looking for somebody that for the year that you're their fellow is someone that they're going to want to work with and want to teach and is going to be engaged. And so being positive, being enthusiastic, being polite to the people that put on the interview day for you, those things are small things, but they go a long way in the interview trail.
And I would just add, just know your resume or your CV to the letter. Somebody can ask you something and you just don't want to, you just don't want to look like you're not prepared for the interview. So just know everything that it's in your CV. You will get asked whatever is in there, but most of the time they just want to know you. But sometimes that can happen, and just want to look like you're prepared.
Yeah, undoubtedly, I certainly agree. Dr. Reina, are there any additional questions from the audience that we may have missed?
We do have one. The question here is, in your opinion, how difficult is it to apply to the breast fellowship?
In my opinion, I don't think it's that hard. I mean, if you compare it to some other subspecialties, like colorectal or complex surgical oncology, I think it's on the easier side. But you do have to use the tools that are available to you properly. You have to take your time to build your application, do it with significant time, identify who's going to write your strong letter of recommendation, build a strong personal statement, get a mentor. You have to do things right. If all of those things line, I think it's on the easier side. If you don't, you're going to struggle as in any other fellowship application.
Yeah, I agree. I don't think it's hard, but I don't think that it's as easy as it once was to match. And I think the match rate has gone down, especially our year, Diego. I think it dropped to like the 60% or something like that.
58 or something like that.
Yeah, when it used to be higher. So it's certainly becoming a more appealing field, and more people applying to it. So I think giving it that dedicated time that it deserves to create an application that will get you into the fellowship that you want is very important.
Mm-hmm. Yeah, agree. It may not be as competitive as other fields, but it's still, competitive, and it's still a real thing. I think it's easy for people to kind of brush off breast in many ways, like other surgeons who shall not be named saying like, oh, it's just breast, or it's basically soft tissue, or whatever, those sorts of comments, and that can kind of get in our heads and make us think that it's not important or not a big deal, but it is. And I think with more people applying, there's a push to see like a genuine long-term interest in breast. And so to really have strong answers to why you want to be a breast surgeon and why breast is important to you. And it's okay if you didn't know, from birth that you wanted to be a breast surgeon. They're not looking for that, but sometimes it's pretty obvious in your CV if all of your work was in another area and then suddenly you changed. And it's okay if you thought trauma and you have a very clear story of like, I was going to do this and then I had this realization and then I changed and then this is what I did after that. But if there's situations where someone's just kind of burned out and doesn't want to do as much stuff and they're just going into breast because they think it'll be a nice lifestyle, that's pretty evident in your CV and your answers to application questions.
Yeah, great. Thank you. So I guess I wanted to make a few closing remarks. And again, just wanted to thank you, all three of you, for joining us for the second installment of Showing Success. It's definitely a series we plan to continue in order to highlight various fellowship programs in surgery. I think today was a really wonderful overview, and I think you all provided a lot of great insight into a beautiful field of breast surgical oncology.
We have one last question that popped up. I'm so sorry.
Perfect.
Just came up. How typical is it to continue taking general surgery call as an attending? Do you find this being a typical question during finding jobs? I think I'm the only one who currently, no, wait, Dr. Johnson, you are also having a job. We're going to turn this over to you.
Yeah, so I think my data for this answer comes from my WhatsApp chat with all of the other applicants from my year, because we all talked about, who's applying for what and just looking at job boards. So there are definitely jobs out there that require general surgery call or some sort of coverage. It might be like covering surgical oncology partners, and may not be breast only or breast call. However, more and more of us are hoping to not do that. So I think that the number of jobs that require it is going down. And if you want that, fine. There's definitely a market for it, but I don't think it's going to be super common, especially moving forward. That was negotiated out of many contracts by some of my co-applicants.
So I'll give a little bit, for those who don't know, I'm a breast surgical oncologist. I'm currently the section chief at Loyola University. That is a very common question that comes up, and you kind of have to decide. I had colleagues that when I was finishing up wanted to do general surgery call because they still wanted to have looking for, and the opportunities are out there. The one thing that I notice is that the more partners you have that are breast specialized or breast surgical oncologist does minimize the amount or the involvement you need to do in terms of general surgery call.
I would also encourage people to think about whether you want to do ports or not and factor that into your job making decisions.
So yeah, I wanted to thank you all again, our panelists, and then all our participants who tuned in this evening. The recording for this event will be on our YouTube channel shortly. And if you're interested in learning more about our organization or becoming a member, you can find us at latinosurgicalsociety.org and on various social media channels at Latino Surgery. Thank you all, and thanks so much for participating tonight.
Thank you so much for having me.
Thank you.
Thank you.
Good luck, everyone.
Thanks again.